the support you are rendering to the people of Zambia?
I think, Moses, you're right that it's a very difficult time, but the importance here is that we've established a partnership with the Zambians, and that's something that President Obama and other world leaders have made clear, that we're not interested in walking away from the partnership that we've worked so hard to develop here. So going forward, I think you'll see that while it is a difficult time, that there are the projects that we've engaged in so far, we are committed to. The American people are committed to.
Mm-hmm.
The Zambians are committed to.
Mm-hmm.
So while it's important to consider that things are changing, and that that we are in a difficult time, we are looking towards the future. We are looking towards opportunities that will come surely after this difficult period has ended, and that's why I think we're so focused on ensuring that a healthy, educated population will ultimately help Zambia and be a good place for investment in the future.
Mm-hmm. Mm-hmm. And some of the successes, Lawrence, you've seen under the component of health. What are some of them? Can you give us some highlights?
Zambia as a whole has done very well in putting people on antiretroviral drugs, and these drugs are truly miracle drugs. HIV and AIDS is a terrible disease, resulting in many infections and chronic illness and wasting. And we're really seeing a Lazarus effect, where people are put on these drugs, they're on their deathbeds, and several months later, they're back on their feet, they're back working, they're supporting their families. Mm-hmm. And that truly is a miracle. But it requires, for this kind of a program, a lot of complex support. We have to have good diagnostic tests. We have to have good laboratories. We have to have nurses and clinical officers and doctors who are trained in how to use these drugs. But most of all, we have to have people who come forward who say that I need to seek these health services, I need to take these drugs regularly every day and adhere to those regimes so that their health can be improved. So it's a partnership on many levels.
Mm-hmm, mm-hmm, mm-hmm. Can you make an addition in line with maybe education, some of the successes you have seen as Deputy Ambassador?
Right. As I've mentioned, I think Zambia is well on its way to achieving its Millennium Development Goal of having all Zambian children in primary school, and I think that's fantastic. I think investment in education is an appropriate investment for the future of a country. We are investing in the next generation of Zambian leaders. And together we're doing that, working with community schools, working with broadcast radio, as I said, working on curriculum development with the ministry in Lusaka to help there to be a stronger educational component here. And I think that Zambia has shown great successes in terms of passage rates, especially for girls. More and more girls are staying in school longer and doing better. That has often been an indicator of future success of a society, both in terms of political stability and in terms of economic growth. This is a long-term investment, though. The investments we make this year in teaching a child to read or teaching a child to do his numbers, we're going to see another generation from now when Zambia takes its place as a middle-income country, as the government has often said, by 2030. Mm-hmm.
Mm-hmm. Well, if you want to get us online, this program is live. The number is 0216-221655, or if you want to give us a text, SMS, our SMS number is 0955-954376. And I'm talking to Michael, who is the Deputy Chief of Mission, Embassy of the United States of America, Lawrence Marum, who is the Director for Center for Disease Control here in Zambia, and also Nick Sadoski, who is the Political Economic Officer under the U.S. Embassy. Excuse me. Now, how do you monitor, Nick? How do you monitor the projects that you support to see that your support does not just go to waste? It does benefit the receiver.
Well, I think my colleagues could speak perhaps to more specific projects, but in general, what we're looking at is the sustainability of the projects that we engage in. We're looking to build upon our partnerships that we've developed so far with the Zambian government, with the Zambian people. So when we look at a project's success, of course, of course, numbers are important. Of course, seeing results are important. But more important, I think, for us is looking forward. What are we doing to ensure that Zambians themselves can take care of these problems? That these are things that aren't going to go away overnight, and we're committed to doing everything that we can to help push along the progress immediately. But as far as down the line, what can we do to work in development with our partners to make sure that the things that we do are being taught?
Mm-hmm.
You know, ultimately we have to stop playing the role of teacher and make sure that we can coordinate things for the future.
Okay. Any addition in terms of your monitoring, Lawrence?
This morning I had the privilege of meeting with the provincial medical officer, who is our partner, our main partner here in Eastern Province, and we fund directly the province and the provincial medical office to carry out some projects. We have a staff member who sits in that provincial office who works very closely with him to help support the activities, to plan them, to carry them out, to monitor them. And one of the messages that the provincial medical officer said to me is that we need to strengthen the system for supportive supervision at the district level, at the health facility level. So working in partnership, working hand in hand, is one of the best ways to monitor projects. In addition, we talked about the laboratory. And this next week there is going to be a launch of the Ministry of Health's quality assurance program for the laboratory to make sure that those laboratory tests are the most accurate, done in the best way. And this is something that the province has taken the lead in helping to develop. So we look at quality projects, and it's more than just sitting in Lusaka and reading reports. We work hand in hand, and in fact that's why we're here on the ground, to see and listen and work together.
Mm-hmm. Yes, Mike.
I think that Nick's point about we're working ourselves out of a job is actually a very important aspect of success. The project's successful when we don't need to be doing it anymore. And in fact, a big aspect of almost everything we do here is how do we hand over to local organizations, to local NGOs, faith-based organizations, communities, chiefdoms, the local government, the national government. The day when Americans are no longer doing this is sort of one measure of our success. However, I do want to add, though, that the numbers that are collected are very important about are we actually using money properly. We have an obligation to the American people. The American people are giving hard-earned tax dollars to their government, which Congress then approves for use here in Zambia for the projects that I've described. And yet there is a requirement for transparency and accountability. The American people demand responsible and responsive government, and they want to know what the money's being spent on and whether we're being successful. And therefore we collect data on whether we are being successful. And in those areas where we're not, we try to change our activities. In those areas where we are successful, we report back to Congress, the representatives of the American people, on how well we're using their funds. This is the same kind of demand that I'm sure the Zambian people make of their parliamentarians and their government. They pay their taxes, and they want to see that their government is being responsive, is being responsible, is being accountable. And we as government officials are doing the same thing.
Well, gentlemen, for now we'll pause just for a short break. When we come back, we'll look at some of the challenges you've been facing, and later on we'll also look at the World Malaria Day, which falls tomorrow. We take a break.
My fellow citizens, I stand here today humbled by the task before us.
We're at a time in history where our challenges are so great.